Hello, my name is Perrin Jones. Today I'm going to be presenting to you how to stop smoking cessation. It's something that needs to be covered. Um, in Madison County, where we currently live, according to the Department of Public Health, an estimated 20% of the population smokes cigarettes. Another alarming number is 8% of pregnant mothers smoke. And smoking firsthand increases health risks for the infant, but secondhand smoke also has its own risks. The Center for Disease Control states that 400 infant deaths occur per year due to secondhand smoke. I also discovered that Madison County's two main causes of death were lung cancer and heart cancer. According to the Center for Disease Control, smoking causes cancer, heart disease, stroke, lung diseases, diabetes, and COPD. Also, according to the CDC, everything I've covered so far, except for the first statement, is going to actually be from the CDC website. They were the main source that I used for this. I think they're very reliable on the topic. Smoking is a significant problem for Madison County in the metropolitan area. This is why I found that this class is very important. And my objective is to educate you on the vast amount of negative effects that smoking cigarettes causes. By the end of this, I want you to be able to understand the negative effects on your health that smoking causes. I want you to understand the negative ingredients that cigarettes contain. I want you to understand your options for smoking cessation. And I want you to have the resources to achieve smoking cessation successful and to be able to provide you with help. I also want you to understand the benefits of smoking cessation and what it can do to better your health once you do quit over time. And I also want you to understand the effects of secondhand smoke exposure. So, according to the CDC, cigarette smoking causes more than 480,000 deaths each year in the U.S. alone. That's nearly 1 in 5 deaths. It causes more deaths each year than all of these combined: HIV, illegal drug use, alcohol use, and motor vehicle injuries. That's an insane amount, considering all the accidents we see, especially related to alcohol use and drug use. Smoking causes about 90% of all lung cancer deaths. I know some of us, of course, that work in the healthcare field see that on a daily basis. We see smokers come in with COPD exacerbations, lung cancer. There's so many problems that smoking does cause. More women die from lung cancer each year than from breast cancer. The main disease caused by smoking is COPD, which includes emphysema and chronic bronchitis. Smoking is the main cause of lung cancer. It's 80% of cases. In 80% of cases of COPD, smoking is the cause. If you have asthma, smoking is worse for you than just about anybody because it can cause an asthma attack. And it can actually make asthma 10 times worse than what it already is. Smoking can make it harder for women to become pregnant. It can also affect the baby's health before and after birth. It actually increases the risk for preterm delivery, stillbirth, low birth weight, sudden infant death syndrome, ectopic pregnancy, and orofacial clefts in infants. It can also affect men's sperm, which can reduce fertility and also increase the risk for birth defects and miscarriage, as we stated earlier. It can also affect bone health. So women past childbearing years who smoke have weaker bones than women who have never smoked. And they are also at a greater risk for broken bones. It does affect the health of your teeth and gums. It can cause tooth loss. It also increases your risk for cataracts. It can also cause age-related macular degeneration. And it is a cause of type 2 diabetes and can make it a lot harder to control. The risk for developing diabetes is 30 to 40% higher for active smokers than non-smokers, which I actually didn't know until I researched smoking and all this information. I did not know that. It also causes general adverse effects on the body, including inflammation and decreased immune function, and it is a huge cause of rheumatoid arthritis. So some positive health effects if you do quit smoking. It can cut your cardiovascular risk. Just 1 year after quitting smoking, your risk for a heart attack drops significantly. Within 2 to 5 years after quitting, your risk for a stroke will reduce to that of a non-smoker. Your risk for cancers of the mouth, throat, esophagus, and bladder drop by half within 5 years. 10 years after you quit smoking, your risk for dying from lung cancer drops by half. And of course, you would have reduced respiratory symptoms and reduced risk of developing lung diseases, and reduce your risk of infertility for women in childbearing age. So nicotine is the main drug that's addictive in cigarettes, and that's found naturally in tobacco products. More people in the U.S. are addicted to nicotine than any other drug, so it is a very, very addictive drug. I think that's why some people have such a hard time quitting, and I think that's why it's crucial to get help, and different ways of quitting, I think, work different for other people, It is hard to quit, and it may require several attempts. People who stop smoking often start again because of withdrawal symptoms, stress, and weight gain, which are difficult things. And I know sometimes people gain a lot of weight and they're like, oh, this is worse than the other. And that makes it very difficult for them. A lot of times they'll feel irritable, angry, anxious, have trouble thinking, will just simply be craving the products, feeling hungrier than usual. It is very difficult to quit smoking. I think it's one of the hardest things to quit, but it is definitely worth it when you see the health benefits. Most former smokers do quit without using one of the treatments that scientific research has shown can work. Some things that are helpful in quitting is getting help from a doctor. They can give you advice and assistance about quitting. Individual, group, or telephone counseling is very helpful to quit smoking. Behavioral therapies, such as training and problem solving, treatments with more person-to-person contact and more intensity can be helpful. Medications for quitting that have been found effective: nicotine replacement products, nicotine patches, inhalers, nasal sprays, Chantix and Zyban, I know, have been effective non-nicotine medications that have helped people. Wellbutrin is also one of those. And I know Wellbutrin is actually one of the only antidepressants where you don't gain weight, or you don't gain weight, you actually typically lose weight. So I know a lot of people have had success with that, but it does have some pretty rough side effects. It's kind of an older antidepressant. Combined with counseling and medications, they've been very effective for treating tobacco dependence, and using them together is more effective than doing one or the other. And I think that's where a lot of people possibly go wrong. I know it's different for everyone, but I think that might be something to think about, is if you haven't tried both of them together and you have tried to quit smoking, maybe try them together. I actually have a phone number for you guys: 1-800-QUIT-NOW, 1-800-784-8669. If you want help quitting, it's a free telephone support service. It can help anyone who wants to quit smoking. You are actually redirected to your state quick lines, which will give you quick information. They'll help give you a plan, or they're there if you just need somebody to talk to. I actually do have a couple of packets. Because of the coronavirus and COVID-19, I have not been able to go out and get these printed. I'm actually on a travel nurse assignment right now. Was also not able to meet with you guys in person because at the hospital they're being very strict about people entering, and we're all gowned up consistently. Our whole unit is actually negative pressure right now, so I'm not even really able to give this presentation. But in some packets I do have online on quitting smoking, fast facts and fact sheet on smoking, and free quit help is available on CDC's website. You can find all of the information you need on CDC's website about quitting smoking. It will give you all the resources that you need to achieve your goal. And I actually have a link to SurveyMonkey for you guys. If you can just evaluate this presentation and let me know if you guys think I went too fast, if you think I provided enough information. And I will have some links for you guys for for that survey to just evaluate my presentation. Let me know how I did, and that would be great if I could get some feedback from you guys. And if anybody has any questions, you can email me and just let me know. All right, thank you.